techniques in fertility preservation, oocyte cryopreservation, sperm banking, ovarian tissue freezing. Fertility preservation techniques are crucial for individuals who need to undergo treatments that may compromise their fertility, such as chemotherapy, radiation, or surgery. These techniques enable individuals to preserve their eggs, oocytes, sperm, or ovarian tissue before undergoing gonadotoxic treatments. The preservation of reproductive cells or tissues allows for the possibility of future family building through assisted reproductive technologies, RT, such as in vitro fertilization, AVF. 1. Oocyte cryopreservation, egg freezing. Oocyte cryopreservation, also known as egg freezing, is the process of retrieving a woman's eggs, freezing them, and storing them for future use. This technique is used to preserve fertility for women who may lose their fertility due to medical treatments or those who wish to delay childbearing. Process of oocyte. Cryopreservation. Ovarian stimulation. The first step is ovarian stimulation, which involves the administration of hormones, typically gonadotropins like FSH and LH, to stimulate the ovaries to produce multiple eggs. This process usually takes 10 to 14 days. Monitoring. The woman's response to stimulation is monitored through ultrasound and blood tests to track the growth of the follicles, structures in the ovaries that contain the eggs. Egg retrieval, aspiration. Once the eggs are mature, they are retrieved in a minor surgical procedure called aspiration. The procedure is done under light sedation, and the eggs are collected through the vagina using a needle. Freezing. The mature eggs are then frozen using vitrification, a rapid freezing technique that prevents ice crystal formation within the cells, thus preserving their viability. Indications for oocyte cryopreservation: cancer patients, women undergoing chemotherapy or radiation therapy that could affect ovarian function. Age-related infertility, women who wish to delay childbearing until they are older but want to preserve eggs while they are still of higher quality. Premature ovarian insufficiency, POI. Women diagnosed with early menopause or ovarian failure. Genetic disorders. Women with genetic conditions that may affect fertility. Career or personal decisions. Women who wish to delay childbearing due to career, education, or other personal reasons. Success rates of oocyte. Cryopreservation. The success of egg freezing largely depends on the woman's age at the time of egg retrieval. Younger women, typically under 35, have higher success rates in using thawed eggs to achieve pregnancy. The pregnancy rate also depends on the number and quality of eggs retrieved and frozen. 2. Sperm banking. Sperm cryopreservation. Sperm banking is the process of collecting, freezing, and storing sperm for future use. This technique is essential for men who are undergoing treatments that could affect their sperm production, such as chemotherapy or radiation. Process of sperm banking. Sperm collection. The man provides a sperm sample, usually through masturbation, at a fertility clinic or sperm bank. In some cases, sperm can be collected surgically, e.g., testicular sperm extraction for men with azoospermia or blockage. Sperm analysis and preparation. The collected sperm is analyzed for quality, count, motility, and morphology. It is then washed to remove seminal fluid and any contaminants. A cryoprotectant is added to prevent ice formation during freezing. The sperm is placed in small vials and stored in liquid nitrogen at a temperature of minus 196 degrees Celsius. The sperm can be stored for many years without a significant loss of viability. Thawing and use. When needed, the sperm is stored and used for assisted reproductive techniques such as IVF or IUI. Indications for sperm banking: cancer patients, men undergoing chemotherapy or radiation that could affect sperm production, men with infertility, men with low sperm count or motility issues who may benefit from sperm banking for future use in ART. Vasectomy. Men who plan to undergo a vasectomy but may want to have biological children in the future. Sperm donation. Men who donate sperm to sperm banks for use in fertility treatments. Career or personal reasons. Men who want to delay fatherhood and preserve sperm for future use. Success rates of sperm banking. Sperm banking generally has a high success rate due to sperm's resilience to freezing and thawing. However, the success of using cryopreserved sperm depends on sperm quality, the number of sperm stored, and the fertility treatment method used, IUI or IVF. 3. Ovarian tissue freezing. Ovarian tissue cryopreservation. Ovarian tissue freezing involves removing and freezing ovarian tissue, which contains immature eggs, oocytes. This technique is particularly useful for young girls who have not yet reached puberty and women who need to start cancer treatment immediately and cannot undergo ovarian stimulation for egg retrieval. Process of ovarian tissue freezing. Ovarian biopsy. A small section of ovarian tissue is surgically removed, typically through laparoscopy. The tissue is then prepared for freezing. Freezing. The ovarian tissue is frozen in liquid nitrogen and stored for future use. Reimplantation or IVF. In the future, the ovarian tissue can be reimplanted into the woman's body to restore hormonal function and fertility. Alternatively, the tissue can be thawed and the immature eggs can be matured in the lab and used for IVF. Indications for ovarian tissue freezing: prepubertal girls. For girls who have not yet reached puberty and cannot undergo egg retrieval. Women who need immediate cancer treatment. When a woman must begin cancer treatment immediately and does not have time for ovarian stimulation and egg retrieval. Women with early menopause. Women who may be at risk of early menopause due to medical conditions or treatments. Women at risk for ovarian failure. Women with genetic conditions or autoimmune diseases that may affect ovarian function. Success rates of ovarian tissue freezing. This technique is still experimental but has shown promising results. The success rates depend on the method used for reimplantation and the number of eggs that mature after thawing. The technique is more established in prepubertal girls than adult women. 4. Comparison of fertility preservation techniques. Technique: ideal candidate. Process: success rates. Limitations: oocyte cryopreservation, women of reproductive age, cancer patients, hormonal stimulation, egg retrieval, freezing, high success, especially for younger women, requires time for stimulation, may not be suitable for prepubertal girls. Embryo cryopreservation, women with a partner or sperm donor available. Egg retrieval, fertilization, freezing embryos. Higher success than egg freezing. Requires a partner's sperm or donor sperm. Ovarian tissue, freezing. Prepubertal girls, women with limited time. Ovarian tissue removal, freezing, later reimplantation. Experimental, lower success rates. Experimental involves surgery and reimplantation. Sperm banking. Men of reproductive age, cancer patients. Sperm collection, freezing. High success, especially in younger men. Requires sperm collection. May not be feasible for men with azoospermia. 5. Conclusion. Fertility preservation techniques offer invaluable options for individuals undergoing gonadotoxic treatments. Oocyte cryopreservation, sperm banking, and ovarian tissue freezing allow individuals to preserve their reproductive cells and tissues for future use. Each method has its unique benefits and challenges, and the choice of technique depends on factors such as age, health condition, and the timing of cancer treatments. As these techniques continue to improve, they provide hope for many individuals and families seeking to preserve their fertility for the future.